and sorted out any health and safety issues which occurred before the experiment took place. The researcher has many responsibilities, for example, checking the equipment. If these responsibilities aren't treated with respect, then the participant could increase the chance of injuries or valuable information being released, which could lead to embarrassment or bullying. If the researcher doesn't complete his responsibilities, then the experiment might not be classified as valid evidence, as they or he could be termination from doing his job, as he didn't do his responsibilities he was assigned to do. The researcher also didn't prepare the subject for the experiment. The consequence of this towards the participant is that they might not know what to expect, so doesn't warm up properly, which could increase the chance of muscle injuries from exercising straight away. The consequences towards the researcher is that it could lead to them having an injury, and as a result, the researcher, which could lead suing the researcher, which could lead to termination of his job. The next poor practice the researcher didn't do was that he was showing equality towards the participants. This would offend the participants as others other well as others were being treated differently. For example, in scenario 2, the researcher was running out of time, so he decided to test the elite performer first and leave the average performers till after. This would demotivate the participants who were put last and would damage their competence. The consequences towards the researcher are that his boss might fire him as a result of being unethical and giving a bad name to the university. The last poor practice the researcher didn't use in this experiment was that the researcher didn't terminate the test when the participant didn't want to continue with the experiment, but instead the researcher told the participant to stop being a girl and carry on with. This would have made the participant feel pressured and forced into continuing with the experiment. This would have made the participant feel like he is weak, which is unethical, and bullying, which could have led to termination of his job or made to go to court for bullying. Example of an informed consent. Scenario 3. Scenario 3 evaluation. Good practice. The good practice for Scenario 3 are risk assessment, which will state all the possible injuries that could prevent them or know what to do when they occur. Another good practice is they use commission deception to make a fair test as it to whether the electrolytes work on your body. However, it could be a bad point as the participant doesn't really know what is being done on them, so might not give consent to it. The last good practice was debriefing. This is important as it informs the participant what the experiment will be testing and what the results will show from the experiment, giving them a great understanding of what is happening. Another good practice the researcher did in this experiment was he had a subject disclaimer, which is when the researcher informs the participant what is going to happen and informs the participant what will have to do in the experiment. The last good practice the researcher did was that he didn't use scientific misconduct. This is when the researcher doesn't use the equipment incorrectly or doesn't treat the participant with disrespect. This is important as it shows that this equipment is not a joke and that it is going to be treated with care for the participant involved and that the experiment will be done correctly and professionally. Bad practices. However, the bad practices to scenario 3 were that the researcher didn't include a health screening test at the beginning of the experiment. A health screening test is a medical test that doctors or physios take to ensure that someone's health is at a good level for them and that they will be fine to carry out activities depending on their health conditions. Before starting the experiment, the researcher must ensure that the participants have undertaken a health screening test to ensure that any associated risks are reduced. The experiment cannot be undertaken until the researcher knows that every participant has completed a health screening test. The researcher also didn't include lab safety procedures. This is vital for a researcher as it ensures the participant's safety around the equipment and informs the participant of all the possible things that could happen and what to do if one of those situations ever came up. To prevent this risk, the researcher has to carry out a check of the equipment that the participants are using to ensure that they are all working correctly. The researcher should also clear all the equipment that might be used beforehand to ensure the risk of disease. The next bad practice was the researcher was he didn't include a briefing at the beginning of the experiment. A briefing is to ensure the participant what the experiment is about and ensure the participant what the experiment is about and what they are trying to find out. To make sure that this happens, the researcher must give a brief description of what the experiment is trying to find out and what is going to happen in the experiment. The last bad practice the researcher didn't include was scientific misconduct. Consequences. In scenario 3, the researcher didn't have a health screening test. The consequences towards the participant could be that if they aren't in good health to perform the exercise, then they would increase the risk of severe injuries or illnesses which could affect their later life, such as osteoporosis. The consequences to the researcher are that if the participant has a severe injury and the participant made it worse by taking part in the experiment, then the participant could sue the researcher for not establishing the participant's health issue at the start. This misconduct could result in termination of job or qualifications. The researcher also didn't include any lab safety procedures. The consequences to the participant could be an injury that needs treatment or hospitalization. This could lead to the researcher being fined and would need to pay the participant for the participant to heal and would have to pay for replacement equipment. Or if the lab hasn't been sterilized, then it can increase the chances of catching diseases which would make the participant or researcher very ill and will have to terminate the experiment. This would mean that the participant would suffer from an illness which could go on for 2 weeks and the researcher could go to court as illegal not to sterilize equipment beforehand. Example of risk assessment.